My name is Bridget Baranek, and this is my pitch plan for obesity prevention. Obesity is a major public health issue. Over the last several decades, rates have risen from 30.5% of the population to 41.9% of the population. According to the National Institutes of Health, 3 in 5 non-Hispanic white adults are considered obese, while 1 in 2 non-Hispanic Black adults and Hispanic adults are considered obese, which point to significant disparities between populations. It's not only associated with a large range of chronic conditions that lead to premature morbidity and mortality, but it's also extremely costly. The CDC reports that in 2018, the United States spent $173 billion on obesity-related medical costs. Obesity has a complex etiology, but there are individual risk factors, and these include physical inactivity, poor nutrition, lack of quality sleep, chronic stress, genetic factors, and certain medications. These individual risk factors are influenced profoundly by the social determinants of health or where people live, work, and play. Despite the attention and efforts directed towards obesity interventions, upward trends are continuing. On this trajectory, more than half of the United States population will be considered obese by the year 2030. Interventions are not enough, and strong multi-level prevention strategies are needed. Creating a culture of health requires awareness within communities and active engagement towards the well-being of all. The literature has shown that community-based participatory programs are well aligned with obesity programming. My proposal centers on this approach, meant to target multiple levels of the socio-ecological model. Community and school gardens can be used as innovative obesity prevention strategies. Gardens can target obesity risk factors and promote a culture of health in a variety of ways. The establishment and cultivation of gardens provides educational opportunities. Implementing garden spaces improves green space, which in turn can improve physical activity metrics. Gardening has also been documented to lower stress levels, which is another obesity risk factor. Evidence strongly supports increased fruit and vegetable consumption is associated with gardening. Establishing community and school gardens provides opportunity for community capacity building to help people more effectively address these health issues. Establishing multiple gardens within a community will require a great deal of collaboration. I'll need a variety of experts and community members to form a coalition. Gardens create more of an impact when nutrition-related education and experiential learning occurs, necessitating nutrition professionals and educators. School systems and park and recreations will need to be included, as many gardening sites will be within their jurisdiction. Input from community members, local government officials, extension programs, and community health workers can help shape garden visions, purpose, and funding. Lastly, schools, parks, and libraries offer public common spaces for educational classes, opportunities, and community feedback. Ensuring community members and stakeholders provide robust guidance in every part of planning, implementation, and evaluation will promote greater ownership and capacity building. In short, community gardens represent innovative, multi-level, community-based approaches to empower obesity prevention strategies. Thank you for taking the time to listen to my presentation today, and here are my references.